So now I'm going to bring up my colleague Elise Mann from the Global WASH team to talk about IDE's work in MHM.
Hi, everyone. So IDE has sold over 1.6 million toilets to date. We work through markets to deliver high-quality wash products and goods. And we have reached over 40 million people in the last 40 years. And normally, when I'm talking around our wash work, I'm usually talking about sanitation. But today, I'm really excited to talk to you all about some emerging areas in menstrual health and hygiene. So our 4 principles here I have up because a human-centered design project that we did about 4 years ago, starting with people. We were talking to a bunch of different people to understand young people in the sanitation value chain in Ethiopia. It was the first human-centered design project that I worked on at IDE. And we heard again and again, you're looking at the wrong topic. And so a lot of people were sharing that they were much more concerned about hygiene and privacy. So thinking both about showers and menstruation started coming up again and again and again. So with that information, we've slowly been starting some additional research to design to context around menstrual health and hygiene, specifically in Ethiopia. And I'm gonna use this space to figure out a little bit about the best role that ID can have in business delivering for menstrual health and hygiene. So some facts for menstrual health and hygiene in Ethiopia. You've got 24.1 million girls and women of reproductive age across the country. 84% of Ethiopia's population live in rural areas, but most of that commercial market is really based in Addis. So there's a big demand and a big potential in rural areas. You've also got 99% of commercial products that are reliant on importing. And 28% of menstruators report having everything they need to manage their menstruation. So there's a really big potential market. As IDE, we really are focused on what is that value add that we can have and how can we help facilitate that larger market. So really specifically, looking at this number, 49% of girls in rural areas reported using sanitary pads. And then some research that our colleagues have done within the country look at the potential market size. So it could be 600 million USD by 2030. There are a number of existing current products I've got listed here, most of which are based in Addis and a couple of other areas throughout the country. So what we did was our team in Ethiopia did both a market analysis and started talking to community members about their experiences of menstruation, knowledge, barriers, where they started learning about menstruation. Was it their mom? Was it their aunt? Was it their friends? And what we learned was it was really dependent. It depended on who was in school. It depended on what your family's relationship was like and if your mom was going to talk to you about it or if it was going to come up when it came up and you'd learn quickly. We have a large amount of research that I'd be delighted to talk to you about more in the small groups, but really want to call out this piece about the lack of supply chain for products in rural areas. So through 2 different rounds of qualitative research, we heard again and again from young women particularly, they were interested in menstrual products, but didn't have the ability to find them in most of the areas that they were living in. From an opportunities standpoint, we've been exploring distribution, sustainable business model, and that increased choice and dignity for menstruators. I'm not going to read through the details here, but would really highlight that what we're trying to figure out now is that sustainable business model, as well as with that increased choice and that increased focus on dignity, that we also need to be thinking about that product life cycle. So disposal is a huge issue around menstruation and something that again and again we see as a challenge across all of our programs when thinking about disposing either in the grounds or in your latrine. And there are a bunch of gaps that are existing within this market, from sourcing of materials, thinking about absorbent pads, ways to access those materials, mostly in larger cities. Some of that absorbent material has to get imported. The demand creation, if menstruators knew about products beyond cloth, beyond however they were already using products to manage their cycle, then they were interested in thinking about trying out other types of products. But if they hadn't learned much about what products could be available in bigger cities, they hadn't thought about it. The waste piece, again, that product life cycle, is the challenge that we're having right now, as well as quality and profitability. It's a pretty low margin topic, and so when thinking about bringing in entrepreneurs, businesses, what's the case to sell products around menstruation? And so our teams went back to the same communities where they had already talked to a bunch of people with these 4 products. So you've got Mela for Her, a day pads, both of which are produced in Addis, disposable pads that are imported, and Noble Cup, which is a bright pink menstrual cup. We took them back and started talking to people and gave out some of these products in partnership with the different companies to have people test them out. And this is a map of the currently using versus the want to use. We don't yet have the data back about from taking the products, not just what they wanted to use, but what they've actually used and how they experienced those things. But so what you see is that there isn't a lot of product use in the current using. And there was a lot more interest in reusable pads here on what people self-reported, but very little access given the lack of supply chain. So where we are right now is we're piloting 2 different ways forward. So working with a couple of seamstresses to add in the creation of pads into what they're already making so that they can sell them directly and add it into their existing work. We also have partnered with some retailers for partnerships with the day pads, as well as Mela for Her, and bringing them from Bahadar into these more rural areas. And that is where I will leave you for now and look forward to talking more about it in the small groups.